I'm Dr. Nicholas Taylor, the Training Programme Director for Forensic Psychiatry, and I'm pleased to be introducing Dr. Shri Kamath, a senior trainee who's going to talk about violent offences, excluding homicide. He's also going to talk about some of the most important studies in this area, particularly the British Crime Survey and the MacArthur study, because these are very common topics for questions in the MRC Psych exam. I'll hand over now to Dr. Kamath.
Hi, I'm Dr. Shri Kamath. I'm a final year trainee in forensic psychiatry here at the East Midlands Deanery. I'm here to speak to you briefly about non-fatal violent incidents and have included a brief lecture on the MacArthur Violence Risk Assessment Study and the British Crime Survey. They're fairly off the beaten track topics for the exam, which most candidates seem to miss out in their revision because they aren't included in the standard textbooks for forensic psychiatry. So in today's lecture, to provide you with an overview, I'm going to show you a pre-test following on with brief definitions for violence and aggression, leading on to the MacArthur study, then a brief lecture on the British Crime Survey, followed by all is revealed answers to the pre-test, followed by a list of references. So as I said, today's topic, violence and aggression, I'm going to include the basic definitions. Not much is asked in this area as far as the exams are concerned, but I'm also going to speak briefly about the types of violence and more so about the types of violence in specific situations. So which of the following are true? People with schizophrenia, 1, are overrepresented among violent offenders and violent inpatients. 2, are more likely to commit minor offences. 3, are less likely to engage in violence or aggression in the community after discharge. 4, are more violent than people with substance misuse. 5, have a similar rate of offending in general as the rest of the population. 6, are more likely to receive a conviction for their offence. 7, have highest frequency of violent incidents within inpatient population. 8, acting on delusions is common whilst offending. The second question relates to the MacArthur Violence Risk Assessment Study. 1 was a prospective study of offenders and their rate of reoffending. 2 indicated that comorbid substance misuse increased the propensity for violence for patients with a psychiatric diagnosis. 3 indicated that strangers were more likely to be victims than friends. 4 homicide was most likely outcome as a result of violence by the mentally ill. 5 the risk of violence post-discharge was highest in patients with a diagnosis of bipolar disorder or depression. 6 had higher rates of violence than the Triangle Mental Health Survey. 7 concluded that the risk of violence was linked to compliance with medication. 8 demonstrated a higher risk of violence linked to the neighborhood in which the patients lived. The last question in this module relates to the British Crime Survey, now known as the Crime Survey England and Wales. 1. Data from police recorded crime does not meet the standard to be reported as national statistics. 2. The data from Crime Survey for England and Wales are national statistics. British Crime Survey is the best long-term measure of crime trends in England and Wales. British Crime Survey is conducted by the Ministry of Justice since 1981. Includes children aged 10 to 15. Has shown a marked fall in violent crimes of nearly 60% since 1995 to September 2013. Has shown an increase in violent crime since it started in 1981, which peaked in 1995. And violent incidents constitute 21% of all crime survey crimes in 2013. I hope that today's module will help you find the answers to these. Answers to these questions are provided at the end of this lecture. Moving on to violence and aggression. Violence and aggression have been widely defined within psychiatric practice. Please note that there are no legal definitions for violence and aggression. Violence indicates that there is the use of physical force against another person, which may be accompanied by aggression. In psychiatric practice, this is often used interchangeably. As you see on this slide, only a fifth of crimes are of a violent nature. The main types of violence, as you see on the right side of the slide, include instrumental violence and expressive violence. Other descriptions are mainly situational, such as gang violence, intimate partner or domestic violence, family violence, and a college favorite, workplace violence. Instrumental violence is exactly what it says of the tin, which is it is used to attain a goal. It is planned, it is not precipitated by increased arousal. An exception to this rule is sadistic violence, which is included within the classification of instrumental violence. Expressive or reactive violence is perhaps the most commonly encountered violence in psychiatric practice on inpatient units, where violence is accompanied by fairly strong affects such as anger. One of the key differences between expressive and instrumental violence is the fact that the former is impulsive, whereas the latter is well planned. This slide relates to workplace violence, which is another question that the college has placed more recently in exams. Workplace violence is classified into 4 types: type 1, 2, 3 and 4. As you can see from the slide, the most common violence we see within our settings is type 2 violence, which is between customer and client. Moving on to domestic violence, 25% of women experience domestic violence at some point in their lifetime. Risk factors include being of a younger age and having economic dependency on the partner. Another key relevant psychiatric aspect here is that there is an increased risk of homicide or assault in women who leave their abusive partners. Another variety of situational violence is, violence within specific environments is the family violence. Homicides are common in the family setting, and newborns are most at risk, with 80% of children who are killed every year being killed by their parents. Within this type of violence, it is important to note that there is a higher risk of violence to children if there is domestic violence. Moving on to the biology of violence. This is an extensively studied field and has been purposefully kept brief to keep it focused for the exam at hand. Firstly, it is shown that there is a clear difference in the neurobiology between people who have demonstrated unemotional violence and explosive impulsive violence. Cortisol and serotonergic dysfunction are seen as the key underlying factors in these two types. It is sufficient to remember for the exam that all types of imaging studies have shown frontal lobe abnormalities. Here is a brief slide which lists non-fatal assaults as used by police recordings and by the courts. There haven't been any previous questions relating to these, and hence they are just provided as information. The next slide provides some statistical information with regard to non-fatal assaults. It is important to note that fatal assaults form a very small percentage of all assaults, and harassment forms 1/4 of non-fatal assaults as a statistic. This slide is more of a legal rather than a psychiatric slide. The key point to take away here is the difference between offences which are tried at magistrate courts and offences that are tried at Crown courts. Summary offences such as assault are tried at magistrate courts, and this has been a question asked in the exam previously. I now come to the answers for the questions in the pre-test. For the first question, people with schizophrenia are overrepresented among violent offenders and violent inpatients is true. This has been shown to be true both within prison populations and forensic units. The second question is people with schizophrenia are more likely to commit minor offences. This is also true. 80% of the offences committed by patients with schizophrenia are minor. Third, people with schizophrenia are less likely to engage in violence or aggression in the community after discharge. That is false. They are just as likely to commit offences relating to violence or aggression in the community as the normal population. People with schizophrenia are more violent than people with only substance misuse. This is false. A large survey in the US has shown that people with alcohol misuse and drug misuse have a much higher rate of offending than patients with mental illness. People with schizophrenia have a similar rate of offending in general as the rest of the population. This is false. Studies have shown that people with schizophrenia have a slightly higher rate of offending in general compared to the rest of the population. 6. People with schizophrenia are more likely to receive a conviction for their offense. This is true. People with schizophrenia are more likely to be found out and are more likely to admit to their offenses, and hence their conviction rates are higher. 7. People with schizophrenia have highest frequency of violent incidents within inpatient population. This is also true. Studies have also shown that key factors in this area are being male, the ward being overpopulated, and meal times and medication times are common flare-up times for violence. Moving on to the MacArthur Violence Risk Assessment Study. This was a study which was published in the Archives of General Psychiatry in 1998 and is seen as one of the first studies to have demonstrated that having a mental illness does not predispose people to a higher rate of violence compared to the general population. It is often a frequently misquoted study because it was a study that was conducted with acute psychiatric inpatients and cannot be applied to patients in forensic and correctional settings. The next few slides sort of touches on the methods and some of the findings of the study with reference to what has been asked previously in some of the exams. As far as methods is concerned, the study was a prospective study of inpatients discharged from an acute ward conducted over a 3-year period and included patients aged between 18 to 40. The study also showed that patients who were discharged from psychiatric inpatient units had a tendency to engage in violent acts depending on the environment they were discharged into. The study also clearly demonstrated that the risk for patients with mental illness to engage in violent acts increased greatly when they used substances such as alcohol or illicit drugs. The MacArthur study demonstrated that a diagnosis of depression or bipolar disorder carried the highest risk of violence in the community following discharge. One of the previous questions asked in the membership exams has related to compliance with medication and the MacArthur study. The study did not look at adherence to medication post-discharge, but looked at attendance at treatment sessions. This is a key point to remember for the exam. In terms of hierarchy of violence committed by patients with mental illness, the MacArthur study showed that patients with mental illness were most likely to commit a violent act against their family, with nearly 50% of the victims being family members. Strangers were only involved in violent incidents in less than a tenth of the total number of violent acts. Homicide was a very rare outcome of violence committed by the mentally ill post-discharge and accounted for roughly about 1% of the violent acts. Coming on to the answers for question 2 from the pretest. The MacArthur Violence Risk Assessment Study was a prospective study of offenders and their rate of reoffending. That is false. It was a prospective study of acute psychiatric inpatients who were discharged into the community. 2. Indicated that comorbid substance misuse increased the propensity for violence for patients with a psychiatric diagnosis. The answer is true. 3. Indicated that strangers were more likely to be victims than friends. That is false. Strangers were least likely to be victims after family members and friends. 4. Homicide was the most likely outcome as a result of violence by the mentally ill. That is false. Homicide is the least likely outcome. 5. The risk of violence post-discharge was highest in patients with a diagnosis of bipolar disorder or depression. The answer to that is true. 6. Had higher rates of violence than the Triangle Mental Health Survey. The answer to that is true. The Triangle Mental Health Survey is another large prospective study looking at violence amongst the mentally ill post-discharge. The sample size was much smaller than the MacArthur study and the follow-up period was briefer. 8. Demonstrated a higher risk of violence linked to neighborhood in which the patient lived. The answer to that is true. I wanted to speak briefly about the crime survey for England and Wales, which seems to appear in the EMQ part of the paper 3 for the exam. Formerly, the crime survey for England and Wales was called the British Crime Survey. The crime survey for England and Wales is a face-to-face survey of a random sample of people taken from the Royal Mail postal list. In the exam, a frequent question is that the survey is conducted from a sample from the electoral roll, which is not true. It is conducted by trained interviewers using a structured interview. The survey is reported by the Office of National Statistics and is administered by them. It has consistently captured higher number of reported volumes of recorded crime data. One criticism of the British Crime Survey or the Crime Survey is that it captures a narrower range of offences, considering these are offences that are recorded through interviews with members of the public. In 2009, the British Crime Survey included or began to include children aged between 10 to 15 years of age. The current response rate for the survey in 2012-2013 was a healthy 73% for adults and 67% for children. The next slide indicates graphically crime trends as recorded by the British Crime Survey since it first began in 1981. The graph clearly indicates that violent acts were on the increase from the time the survey began and peaked in 1995 to come down quite significantly over the years, to the extent that the 2013 September results indicated that there was a 60% fall in violent acts or violent crimes since their peak in 1995. I move on to the answers for question 3. Regarding the British Crime Survey, 1. Data from police recorded crime does not meet standards to be reported as national statistics. The answer to that is true. 2. The data from the crime survey for England and Wales are national statistics. That is true. British Crime Survey is the best long-term measure of crime trends in England and Wales. The answer to that is true. The British Crime Survey is conducted by the Ministry of Justice since 1981. The answer to that is false. The British Crime Survey is conducted by the Office of National Statistics since 2012. Prior to that, it was run by the Home Office. The British Crime Survey includes children aged 10 to 15 years. The answer to that is true. The British Crime Survey has shown a marked fall in violent crimes of nearly 60% since 1995 to September 2013. The answer to that is true. The British Crime Survey has shown an increase in violent crime since it started in 1981, which peaked in 1995. The answer to that is true. And finally, violent incidents constitute 21% of all crimes seen in the survey in 2013. The answer to that is true. Thank you all for tuning into this webcast. I include a list of references. Most of these references are directly related to the slides you have seen in this lecture. I'm hoping you are able to access them and gain more information. Wishing you all the best. Thank you.